The biggest cancer we tend to worry about is melanoma. Now, there are other types of skin cancers that are really rare, some of which are really dangerous, others that are kind of lower grade cancer, but melanoma is the more common one you hear of that people get concerned about because it's an aggressive tumor, it can spread through the body, and there's mortality associated with it. So as far as melanoma goes, we generally try to teach people about the ABCDEs of melanoma. So if you're looking at a mole, generally speaking, or we'd like it to look round, small, brown, kind of one color, and look uniform throughout the entire lesion or look the same. So the ABCDEs would be, A would be asymmetry. So if you cut it in half and one half looked different than the other half, that could be a more concerning sign. B would be border. If it has a nice, smooth, round, regular border, we like that. If it's really jagged, irregular, it just looks odd, that's more concerning. C would be color. Certainly things that are multiple colors or areas that turn black gets more concerning. D, diameter. They generally say if it's bigger than an eraser of the head of a pencil or 5-6 millimeters, it's a little higher risk. That being said, we've seen melanomas that are smaller, but the larger would be more concerning. And E is probably one of the more important ones people don't talk about a lot, which stands for evolving or changing. So if you've always had a mole that looks a certain way and it's always been a certain color and size and shape and all that, and then over a period of 6 months to a year, wow, it's doubled in size, now it wants to bleed and grow and it's changing, that's something we would want to pick up. And those are kind of some worrisome signs for melanoma. Then when you come in and you see us, if you have an area that you're concerned about or wanted just us to check you over and make sure nothing looks dangerous, well, if we see something that looks suspicious, we usually would numb it up and do what's called a biopsy and get it tested, know for sure what we're dealing with. And if it turns out it's not harmful or concerning, great. And if it doesn't, or excuse me, and if it does, and if it's something of concern, then we usually do surgery in the office and cut them out. And depending upon how aggressive the melanoma is, some people just need surgery. Others, if it's really deep or concerning, might need lymph nodes tested, imaging, PET scans, things like that.